Now, the NHS should be abolished to save lives, according to a new report.
NHS funding comes from taxation, of course. That's how we fund it in this country. But other countries in Europe pay for health services through a compulsory national insurance fund or private insurance or a combination of both.
Yeah, it comes as a YouGov poll revealed 29% of Britons say the NHS is worse than European healthcare systems. So, is it time to scrap it and find an alternative? Joining us is broadcaster Alex Phillips, who says the NHS needs replacing or more people will die. And also joining us, Dr Chan Nagpal, who says we can't compare the NHS to health services in Europe. Alex, let me come to you first then. You're saying it should be abolished. There'll be a lot of people at home frightened by that prospect. We rely on the NHS as a free service. It's a simple to understand service.
Free at the point of need.
Yeah, exactly.
Yeah.
That, if you take any other alternative, it feels like it could be quite complicated, quite confusing for a lot of people.
Well, that's because that's what people have been told or missold for a number of years. Now, I was a resident of Belgium, so I've seen how their healthcare service works up close and personal. I had surgery on my ankle in Belgium. And the point here is what people want is a healthcare service that they can access free at the point of delivery. That must always be maintained, but where they also get patient choice and where they see standards uplifted. We hear time and again that we don't invest enough in the NHS in the UK. And there's an argument to that, actually. We spend what is average around Europe, but that is about 30% lower than some of the leading healthcare systems. The problem when you have something that is nationalised is when the argument happens that you need to put more money into the NHS, that means that money has to come out of another government department. That is a political choice. That means taxes have to go up. This is why year after year after year, the resources are not being made available. I think that we can follow some sort of hybrid model, as I have seen operating brilliantly across Europe, where standards are much higher. And frankly, what is happening now in the UK is a more complex model over here, because now 1 in 5 of us have chosen to take out private medical insurance. That's up 80% in just 2 years, which means we now have a two-tier system where people are getting stuck at the GP to get referrals, to get into the private sector. Frankly, the entire thing is a mess, and I don't think we should be ashamed or lack the courage to look in how we can actually completely change the model that we use.
So you said you were in Belgium. Tell me what you did there then. How much did it cost you there, and how much were you contributing to the health service?
Right. Well, basically, your insurance is added to your employment. So when you get your wages at the end of the month, a degree of money is taken out that goes to your private medical insurance, and you're issued with a card. So when you go for treatment, that card just slots into a machine when you go to your polyclinic or the hospital or so on and so forth. And that is how it's handled there. And there's a system where if you're out of work or you're on benefits, then you have state care. So there are hospitals which deliver just state care, and those in the private sector as well. The majority of people use the private sector, but that means that those people who really do need medical care but have slipped through the net of employment have it, and that system is alleviated from the burdens that our system seems to struggle with. Okay. And that's where I think the freeing of the system's good, because people can then choose. When I broke my ankle, people are like, which hospital did you go to? Was it good? And I think that's really elevated standards.
Dr Nagpal, what's wrong with that?
No, I think, it's absolutely correct that many of our European nations provide a more accessible service. But ultimately, the real problem with the NHS is it has a gross deficit of infrastructure compared to our European neighbours. And in fact, when you look at the number of doctors, for example, an average European country has about 30% more doctors, twice as many if you're Germany. If you look at hospital beds, there are 3 times as many hospital beds in Germany compared to the UK, twice as many in France. So that's why people are able to access those healthcare services more easily. Now, if you actually were to have an insurance system, in actual fact, it will diminish the available funds in the NHS. And Belgium, which was given by Alex as an example, has twice the administrative costs of the NHS. So, in fact, just changing the system to a different model, like an insurance system, is not going to help the NHS, because what the NHS actually needs is the doctors, the nurses, the hospital beds, the community facilities,
the doctors,
and the investigative
the nurses,
facilities.
the hospitals cost money. And what we're fundamentally talking about here is, aren't we, is how do we fill the deficit you described? Where do we get the money from? And I guess you know, the description that Alex said of some kind of insurance linked to employment, in her case, might be a way of raising that money via an insurance system to supplement. I think that's the argument. Take issue with that if you like, but I think no one's suggesting we need fewer hospitals or fewer doctors and nurses. It's just how to find the money for them.
I'm not sure that, in fact, it would be right and the public would really want to be double taxed, that they're already paying enough taxes for our health service, and then to start paying further for insurance policies on top of that. I don't think that's what Alex is referring to. So I think the burden for people paying for health is already quite high, and I think that the most important thing is to be as efficient as you can. And there's no doubt that an insurance system adds costs. It adds transaction costs, billing costs, claiming costs, and in fact, therefore, it's to me pretty clear we need to just,
I'm not suggesting that you would advocate the American model, but in America, if you break your leg, it costs around $33,000. That comes from an insurance that you paid into, which, if you're wealthy, of course, you could afford a good one. If you're not so wealthy, or in your case, in the description you said, maybe self-employed, where you haven't got that access to an employment funding in the same way, then you don't get... Whereas in the NHS, a broken leg costs £3,000. So there is a kind of scale of inefficiency that I think Dr. Chan is referring to.
Right. And I actually think he makes a very good point there, because we don't have to copy the American model. I wouldn't advocate that. And I think actually being able to bid for medicines, for example, at state level, where you can have a bigger sort of wholesale package and get things at a lower price, is a good model potentially to follow. And there's no reason why that can't be assimilated into a new system that we would develop bespoke for Britain. Now, what's interesting is elements of the NHS are privatised. So Dr. Chan Paul's a GP. GP practices are, in essence, a privatised business that sell their contracts and their services to the NHS. And where you look at other parts where dentistry is privatised, where optical services are largely privatised, you tend to be able to get an appointment.
Because we know there are people putting their own teeth out because they can't get access to a dentist.
This is a model.
That's the sort of fear people will be wanting.
There are not enough. There are not enough NHS dentists. There's not enough dentists in the state sector. But other people take out private dental insurance, and they are the ones who have access to good healthcare. And which one is the one performing? My argument is, and I agree with Dr. Chan Paul, that we have a massive lack of investment in the NHS. We have a lack of doctors and nurses, and the reason we have that is these are political choices. It is up to the government to decide these things. It's up to a government to decide to lift the cap on educating doctors and nurses in this country. It's up to the government to decide how much money is put into this, that and the other. That is the problem here. This is why there is essentially a ball and chain around the ankle of the NHS, because it's constantly a political choice, and there's no flexibility. It's very hard for a government to be creative and get more money to pump into it.
Dr. Chan Nagpur, your response to that?
Yes, so first of all, I think we're in agreement. The fundamental problem with the NHS, and let's not use words like money, just to say, if you have the lowest number of MRI and CT scanners in this country, if you have a third the hospital beds of other countries in Europe, if you have 30% fewer doctors, of course that's the problem. And in fact, if you went to Belgium or the Netherlands or to France or Germany and actually took out half of their hospitals, I don't think their insurance model will actually deliver care for their patients. And if I can say one thing about private services, in the NHS, we have tried private providers. A hospital in Cambridgeshire, Hitchinbrook Hospital, was taken over by Circle Health, a private international company that thought it could run the NHS better than the NHS. And in fact, within a third of its 10-year contract, it had to exit because it just couldn't deliver the care at the same cost as the NHS. Babylon, at hand, this is what Matt Hancock used, the video service for GPs. They thought they could provide GP service. They've exited from the UK market. So in fact, I think it's a real myth that commercialising the NHS will be cheaper or more effective. The evidence shows the opposite.
All right, it's worth saying we don't have any comment or feedback on any of those points you've made from either Babylon or Circle on that. Just very, very quickly, though, with people at home watching right now who are suffering, especially with winter coming, they can't pay their bills, they'll be thinking, well, shouldn't those people who can afford it, those who are wealthy and well off, be paying for their own health. And the France model is if you're over 65, you have a chronic illness, you get fully covered. For those that aren't, then they have to find some other insurance as a supplement. They get some services paid for. Aren't we at that point now? It is unprecedented times, cost of living, the time of austerity. Shouldn't those that afford it absolutely pay for some elements of their own health service? Dr. Chand.
Well, you know, we do have that in the sense that taxation means that those that earn the greatest,
but they're not
contribute
forced
the greatest
to, are they?
To our health service.
But they're not forced to, are they?
They are. Our taxation, in fact, the insurance model, which, as Alex said earlier, is compulsory in those nations, is no different in that sense that everyone's paying for the health service. What the evidence shows is that having a tax-funded system the way we have is actually highly efficient. As I said earlier, we have got probably the lowest administrative costs in Europe.
Okay.
We're very lucky that we actually had the advantage of setting up a health service, in 48 in the way it is currently operating, highly efficient. Okay. The problem, as I said earlier, is very, very straightforward. We don't have the beds, we don't have the GPs, we don't even have the community facilities. We have the lowest community beds in Europe. So these are the deficiencies, and if you don't correct those, I think we're just being misguided, trying to talk about changing the system into a more expensive transactional model.
We're going to have to leave it there.
So fascinating, both of you. Thank you for both your points. It's a really interesting debate about where we go.
I'd say it was a very healthy debate.
It's a very healthy debate. Thank you very much indeed. I'm sure we'll come back to that, and thank you for all your comments too.